Are you using your inhaler spacer device? Because 90% of patients don't use their inhalers correctly. So, you've been prescribed the metered dose inhaler and a spacer device. But are you using it? I get it though, spacers can be bulky and they can be difficult to carry with you, especially if you don't have a bag. But remember this. Let's go on to the next scene. Spacer devices allow more medication to reach the right part of the lungs, which means better disease control and possibly less frequent use of your inhaler. So, before we learn how to use our spacer device, let's take a closer look at it. At the front of the spacer is the universal end cap which the metered dose inhaler goes into. Next is the antistatic chamber which the medication flows through and stops at the valve. The valve then opens when you breathe from the mouthpiece. Some spacers also have a mask where the mouthpiece is, but the mechanisms are all the same. Now let's learn how to use it. Step 1. Remove the cap from your inhaler and from your spacer and look inside them both to make sure there's no foreign objects inside it. Step 2. Prime your inhaler if it's the first time you're using it or you haven't used it for a while. Every inhaler is different, so always read the information leaflet. It's usually 2 sprays away from yourself, and now it's primed, so you're going to get the right amount of medicine per dose. Step 3. Shake your inhaler so the drug mixes with the propellant.
Do you mean like this?
Exactly like that. Because if you don't mix, you're going to get more propellant coming out than drug. Similar concept to deodorant. Step 4. Stand or sit upright, tilt your head back, breathe out gently, and then wrap your lips around the mouthpiece without biting it. It's important to hold your inhaler like this, so it's straight and not like this. Step 5. Now it's time for the fun bit, but there's going to be 2 techniques that I show you, and they're both as good as each other. So there's the single breathing one and the tidal breathing technique, which is the preferred method for children. Breathe in slow and deep. Just after you begin to breathe in, press the canister down and continue to inhale. Remove the spacer from your mouth and continue holding your breath for 10 seconds or as long as is comfortable, then breathe out gently. And that's the first technique. Now let's see tidal breathing technique. Just after you begin to breathe in, press the canister down, breathe in and out normally 3 times through your mouth if your Aerochamber has a mouthpiece like mine, or 5 times if it has a mask. Remember, you don't need to hold your breath at the end of this technique. Now that was fantastic. And if you hear that whistling sound, but I think it sounds more like a harmonica, it means you're inhaling in too fast, so slow it down. And if you need to take another dose, repeat the whole process again after 30 to 60 seconds. And once you've finished, replace the cap on your inhaler and your spacer. Now that you know the technique, here's some additional information which you may find useful. Tip 1. Make sure the spacer forms a good seal around the inhaler. And if it doesn't, speak to your pharmacist about it. Wash your spacer once a week by soaking in lukewarm water with mild detergent for 15 minutes, then rinse well. After washing, allow the parts to air dry in a vertical position. Don't dry using a cloth as it can cause static, which makes the medication stick to it. Tip 3. Replace your spacer every 6 to 12 months. And that's it. You're now a spacer pro. And as always, make sure to like, comment, and tag friends who'll find this information useful. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos. It's important to rip your lips. Rip your lips. If I play you this flute, will you dance? I also made a video. Oh my god, it's when I filmed, it's like a massive skip outside. He's like filling waste.